The Canadian government has proposed to legalize recreational marijuana this summer, which brings along with it an abundance of questions and concerns from employers and HR departments regarding the safety of their workforce. Jason Fleming and Shelley Brown, experts on the topic of marijuana safety in the workplace, share their advice on how to create the best policies for health and safety as potentially more employees will start using the drug.
So the biggest concerns that we're hearing about is impairment in the workplace. So essentially impairment in the workplace leading to safety incidents, as well as impairment in the workplace leading to conduct issues at work. Second would be higher instances of cannabis addiction. Not many people know that cannabis is addictive in about 10 or 11% of people who use it.
The biggest thing that employers need to do and human resources professionals need to do is communicate. They need to start communicating now before it becomes legal, so that employees understand what the legislation means to them and in the workplace, and then what the policy will be going forward. So a lot of employers are starting to look at their policies now.
There's got to be a clear understanding of what is an absolute safety bedrock policy. So you can't be impaired at work, when to disclose cannabis use, ensuring that those kind of black and white elements are very clear for the workforce. I think it's important to distinguish between medical cannabis and recreational cannabis, because medical cannabis is authorized by a physician. There'll be a different accommodation process for medical cannabis versus recreational cannabis, which is really used for fun and for, kind of recreational weekend use.
The biggest issue is for medical marijuana. It is protected under privacy legislation, and that's pretty standard as far as how it needs to be treated. It's treated like any other medicinal drug that an employee would be prescribed.
It's important to look at a lot of these situations on a case-by-case basis. So if you're thinking about medical accommodation, an employee discloses that they would like to start using medical cannabis, ensuring that you're not giving a knee-jerk reaction to those inquiries or those requests, taking some time engaging third parties like occupational therapists to conduct a risk assessment and to really go through a thorough accommodation analysis process to ensure that you're respecting their individual rights and taking into considerations for each employee and whatever role they're holding.
Health and safety is the foundation of the policies that need to be put in place by human resources. The biggest issue is that any kind of impairment at work, whether it's from marijuana or whether it's from alcohol or whether it's from any other source that compromises safety, is absolutely unacceptable, and HR and the health and safety officer have to deal with it immediately. So this is where I think they do need to coordinate and talk about both of their roles in this, coordinate on the policy and also coordinate on the communication to the employees.
HR professionals should be sure to approach this change in legislation with transparency, an open flow of communication, and respect for employees, with safety always on top of mind. For more videos, visit us at hrreporter.com. Signing off, I'm Alexia Capralos.